My name's Ian Hahn. I'm an assistant professor in the Department of Ophthalmology. I think it's a bit of an unusual name because the first name I have is basically an English, Scottish, Irish name, and the middle name I have is actually derived from Brazil because my father grew up in Brazil, and the last name is a ethnically Chinese name. My name basically summarizes my background, which is that it comes from a lot of different areas, and I bring a lot of different experiences and culture, basically, to the clinic with me. I'm a retina specialist, which means I deal with any condition that affects really the back of the eye. That includes something called the vitreous gel, as well as the retina, which is the nerve light-sensing tissue at the back of the eye. And the common conditions I see are diabetic retinopathy, macular degeneration, as well as anything that requires surgery, including retinal attachments, macular holes, epiretinal membranes. Patients should recognize that I'm not that intimidating and that I'm just trying to get to know them and treat them the best I can. When I come into a room, I understand that they're coming from potentially a long way to see me, and I also want to take the best care of them that I can. So it basically starts with an introduction, getting to know them, how their vision affects their everyday activities and their usual needs, and then we can start thinking about the diseases that are affecting that ability. I wanted to join part of the team. I choose the word team very carefully because I think that basically is what summarizes our attitude and approach here. There's a lot of collegiality. It's a really intense environment with a lot of smart people that really work well together and recognize that the underlying goal is to help people see better.